Our country is seeing what's being called an alarming surge of pediatric respiratory illness. Now, the American Academy of Pediatrics and the Children's Hospital Association have asked the federal government to declare an emergency to support hospitals. In today's Your Healthy Family, I'll show you when it's time to take your sick kid to the hospital.
It's hit harder and earlier than usual. Respiratory virus season is here.
It's been a couple of years since we've really seen our kids significantly ill.
If your child is severely sick, in distress, having difficulty breathing, a change in color, or significant difference in energy level, it's time for medical care. Otherwise,
it probably is best if you stay home. And unfortunately, we may not have a lot more to offer.
Pediatrician Andrea Singh says caring for a sick child at home starts with over-the-counter medicine. If your child is old enough, Dr. Singh says fever-reducing over-the-counter medication can help.
Fevers in and of themselves are not a reason to come into the emergency room unless they're persisting for a long time, more than 4 or 5 days.
When it comes to the flu, the CDC says the hospitalization rate nationwide hasn't been this high this early in the season in more than a decade. That rate for RSV is about 10 times higher than it usually is this time of year. But for sick kids who don't need to go to the hospital, Dr. Singh has some recommendations.
Children over 1 can have a spoonful of honey to help with coughing fits. Lots of hydration that thins out the mucus and helps. Lots of rest, kind of your old-fashioned remedies at home.
Now, I did reach out to NCH Healthcare System to find out what kind of trends they are seeing right now. I'm told the last few weeks are trending high in the dominant strain of influenza A. It says by the end of October, total case numbers rose sharply, but not as high as what we saw in 2021. As for RSV, NCH is not seeing the dramatic increase right now like in other parts of the country, but they are expecting those numbers to trend up. And right now, NCH is seeing mostly rhinovirus and enterovirus in kids.
We are